And hospitals across the country are bracing for what could be a massive influx of patients with coronavirus symptoms. Our Alexa Liautaud spoke with an ER nurse at one of the Bay Area's largest hospitals.
The important thing for the public to know is that this is really a crisis on top of an existing crisis. In the hospital I work at, Highland Hospital in Oakland, we're already stretched beyond the limit every day for years and years on staffing, on equipment and training. We've been pushing really hard as a group of workers that our hospitals follow the Cal OSHA standards, which are really strong. We're hearing over and over those standards being ignored, and pushing for us just to think about the CDC guidelines, which have been really rapidly decreasing.
Are you concerned about the overcrowding in the hospital when you have a virus that is spreading so quickly?
We're already overcrowded. I've had friends and family ask, is the hospital getting crowded? And it's, the answer is we've been overcrowded for a long time, for years, and we're not ready. We have, a number of codes that people are probably familiar with from TV that get called overhead in the hospital and announced to everyone, like code red for a fire. One of those for us is an internal disaster where the hospital is too overcrowded to be able to see new patients timely. So what that actually looks like in practicality is that patients that need things quickly can't get them at all, and the standard of care is rapidly lowered. So we have patients that would need to be like on a heart monitor in the hallway. Recently, in the last month, I worked a Saturday and I finished my shift. And when I came back on Monday, I saw some of the same patients in the same beds in the same hallway in the ER, stuck in the ER because there's nowhere to go upstairs. What's going to happen is that very, very quickly, people that need care are not going to get it, and we're going to be doing sort of wartime triage.
Is triaging between people one of your biggest fears at this point?
Nobody wants to have to make a choice between two people that both need something that could save their life. We're going to have to decide quickly between which of these 2 or 10 or 3 patients need to be put on a ventilator, because we do not have enough ventilators to take care of all the respiratory patients that we're going to be getting. I don't know the total count at my hospital, but I can imagine if we all of a sudden got 6 patients that had respiratory failure right now, there aren't enough ventilators to use for them. And definitely not enough trained people to operate those ventilators. On a bigger scale right now, we need the government to step in. We need rapid up-staffing. We need lots and lots of extra nurses aides, respiratory therapists, volunteers. That's the kind of stuff we need. And we're asking it of our employers, but I think in this case, the government really has a lot of power to bring the resources we need.
A spokesman for Alameda Health Systems, which operates Highland Hospital, said in response to charges that the hospital wasn't prepared. Hospital that always operates on a very thin margin. We're already facing a challenging situation. These people we see every day, homeless, income folks, are the same people who will be most devastated by this crisis. They come to the public health care system in California. Coronavirus adds to that challenge. And in Italy, the death toll is near the global record for deaths in a single day, with more than 700 people dead in the last 24 hours. If you're not following Sky News' correspondent Stuart Ramsey, you should. He has been doing some remarkable work, and today he takes us to Lombardy, where a hospital is so overwhelmed it's on the brink of collapse.
They've run out of room at the morgue, but they haven't run out of respect for the dead at Cremona Hospital. The next batch of the lost waiting for cremation are laid out in the hospital chapel before collection. Their families couldn't even say goodbye. They're all in quarantine. It's a recurring theme now. Everyone dies alone. They came from here, the hospital's intensive care unit, which is on the brink of collapse. This is what it looks like when the virus overwhelms, and here in Lombardy, it's overwhelming. These patients are critically ill. In all probability, they won't make it. The staff have no cure available to them, They're just trying to keep them alive. Every 13 to 16 hours, they turn the patient over to relieve the pressure on the lungs. Without doubt, she wouldn't survive without constant attention. The patients are highly contagious. Where possible, they're observed from a distance, but most of the time, that isn't possible. Nobody takes any risks. They wash and sanitize constantly. Gloves, masks, and protective clothes are regularly changed. In truth, these men and women are exhausted. The system is at breaking point, and they are as well. But they keep going. They aren't the front line in this war. They are the only line.
It's a very dangerous, is a disaster, is a tsunami. And we are here 12 hours a day. Only we are going to home for a few hours and come back here for the work, because we are here for the patients.
The first, perhaps only bit of good news for the teams here is this man. We couldn't approach him. He's still too weak, but he waved. He is recovering. After 2 weeks, he is getting better. In that 2 weeks, though, not one other person on this ward improved, or worse, they died.
What's really interesting here is that now they've had to extend the intensive care unit, but now it is absolutely full. It's absolutely full in every hospital in Lombardy. They're hoping that some can be taken away. And the other really frightening development is that the patients are getting much, much younger because they are not being treated in hospital because there's no room for them. That is a big, big change, because the virus has mainly affected the older age groups. Now they're talking about people in their 30s and 40s. That hasn't been seen anywhere so far.
The only illnesses being treated in Cremona Hospital now are linked to the coronavirus, and it's spreading.
We opened this side of the department to intensive care only yesterday, and today it's already full.
Well, so in one day it's full?
In one day, less than one day, yes.
Emanuela Catanacci is a neurosurgeon normally. Now she's working in intensive care. She asked to send a message to the world. Lockdown.
If you can see what's happened in another country or in another part of your country and wait to do something, I think now it's not more an option. Maybe at the beginning we didn't know exactly what would be happen, but now we know what happened. It's you don't think that it's happening here and it can't happen everywhere else.
It will.
Because it will if you don't do anything to stop it.
In Lombardy, they haven't run out of hope, but they're struggling with pretty much everything else. They're waiting for the epidemic to peak, but it could be weeks. It could be much longer. Stuart Ramsey, Sky News, Cremona, Italy.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.